This is a good question. Okay, so a man collapses on a tennis court, and it's not heart attack. It's a ruptured aneurysm. And if we zoom in, we find something deeper. I'm not going to tell you, but it's a ventricle problem. Okay, so is it hypertrophic or not? So we got a 67-year-old man dies. Autopsy shows a left ventricle that's problematic with thin walls and an aortic root aneurysm. What's the cause of the change? It's going to be your sarcomeres added in series or parallel. It's going to be series because it's a dilated left ventricle. So the way that they're going to ask this is going to be awesome. They're going to say, hey, we got this dude, a septal thickness of 1 centimeter. Normal is 1.1. And that will rule out hypertrophic cardiomyopathy, because hypertrophic cardiomyopathy would be thickened walls. And here our walls are normal. But then there's this internal left ventricle diameter that's ginormous. It's just huge. And so it's dilated. And it's eccentric hypertrophy. And those are in series. They're not concentric, right? They're eccentric. And so it's going to be a dilated cardiomyopathy. So why then is the answer going to be sarcomeres in series? Well, that's just dilated cardiomyopathy. But another way that they could ask this question is, what's causing it? What's causing his findings? They'll say it's like a sudden event. And so he's got like a aortic dissection. Well, the answer is going to be aortic regurgitation. So that's a chronic aortic regurgitation that leads to eccentric hypertrophy. So aortic regurgitations. What do we know about those guys? So aortic regurgitation could cause, you think about where your left ventricle is. It's pumping out to the rest of the body, and then it goes to the aorta and back out again to the body, right? And so we're going to dilate that left ventricle because the aorta is going to be allowing some regurg to come back into the left ventricle, causing more volume. So that volume expansion, dilated left ventricle cavity, is going to be causing these symptoms that we see. And so aortic dilation is one of the most commonly caused by chronic aortic regurg. Aortic root dilation is. And so if you have an ascending aortic aneurysm like the dude in our question, then you likely have an aortic root dilation that is going to be consequent with your aortic regurg. So then you have more volume. That's basically how it works. Just more volume because of the aneurysm. And so then it causes eccentric hypertrophy, dilated cavity, and that's what's happening in our dude. Parallel, so that would be pressure overload. Be like your aortic stenosis or hypertension. Think about it like you're pushing through and you have parallel sarcomeres, so it's like concentric thickening, so it's like high blood pressure. Amyloid, restrictive, be restrictive. Lipofuscin is just age-related. It's like the oxidation of like fat. Myofibrous dysarthria is hypertrophic cardiomyopathy, usually in like younger athletes. So yeah, cool. I like that question a lot.